They start exactly the same, but end in completely different places. The tenderness, the cramps, the mood swings. How do you know if your body is preparing for a period or for a new life? That's the question we're here to answer.
The journey into parenthood often begins with a silent question, an intuition, or perhaps a small sign the body sends, almost like a whisper. While many associate pregnancy directly with a missed period, the truth is that incredible transformations may already be happening long before that. Welcome back to XHEALL, your channel for unraveling the mysteries of health. Many women, especially those who are trying to conceive, pay close attention to every little change in their bodies. But is it possible to identify signs of pregnancy even before a test can confirm it? Are there early symptoms that can indicate the beginning of this new life? And how can you differentiate these signs from common menstrual cycle symptoms? In this video, we'll explore the very first signs and symptoms of pregnancy, those that can sneak up on you even before the famous missed period. This is valuable knowledge for anyone seeking to better understand their body, and it's fundamental for health professionals, especially in nursing and medicine, in providing precise guidance to their patients. Stay with us to discover what your body might be trying to tell you. It's important to remember that every woman and every pregnancy is unique. Some may feel several of these early signs, while others might notice almost nothing. Furthermore, many of these symptoms can be confused with PMS or other conditions. That's why confirmation with a pregnancy test and medical follow-up is always essential. Right after the egg is fertilized by the sperm, a series of hormonal and physical events begins. The fertilized egg, now called a zygote, travels down the fallopian tube and implants itself into the uterine wall, a process called implantation, which can occur 6 to 12 days after ovulation. It's from the moment of implantation that the body begins to produce a crucial pregnancy hormone, human chorionic gonadotropin, or HCG. This is the hormone that pregnancy tests detect. In addition to HCG, the levels of other hormones like progesterone and estrogen also rise significantly. It's these hormonal fluctuations and surges that are primarily responsible for most of the early signs and symptoms. Let's get to the signs that can appear even before you notice a missed period. Implantation bleeding and light cramping. Some women experience light bleeding or spotting, usually pinkish or brownish, that lasts from a few hours to a day or two. This could be implantation bleeding. Light cramps, similar to menstrual cramps but often milder, may also occur. This is often mistaken for the start of a period. Tender and swollen breasts. Your breasts may become sore, sensitive to the touch, fuller or heavier. The areolas may also darken, and the small Montgomery tubercles, the tiny glands on the areola, can become more prominent. This happens due to rising hormone levels. Fatigue and extreme tiredness. Feeling exhausted for no apparent reason is one of the most common and earliest symptoms. The surge in progesterone, along with the body's energy demands to support a new life, contributes to this fatigue. Nausea, not just in the morning. Although known as morning sickness, it can occur at any time of day or night. Some women only feel an aversion to certain smells or foods, while others might experience more intense nausea. Increased urination. You might find yourself going to the bathroom more often than usual. This is due to the increased blood volume and the extra work your kidneys are doing, as well as the initial pressure of the growing uterus on your bladder. Mood swings. Hormonal fluctuations can cause irritability or heightened emotional sensitivity, or you might find yourself feeling weepy for no clear reason. Similar to PMS, but sometimes more pronounced. Mild headaches. The hormonal surge can also trigger headaches in some women during early pregnancy. constipation and bloating. Progesterone can slow down digestion, leading to constipation and a feeling of being bloated. Many of these signs, like breast tenderness, cramping, and mood swings, are very similar to those of premenstrual syndrome. So, how can you tell the difference? The main distinction is that PMS symptoms usually disappear once your period starts, whereas pregnancy symptoms persist and may even intensify. The most reliable way to confirm a pregnancy is with a test. Over-the-counter urine tests detect HCG and can be quite accurate from the first day of a missed period or even a few days earlier for more sensitive tests. Blood tests, quantitative beta-HCG, are even more precise and can detect pregnancy earlier. If you suspect you're pregnant, the best course of action is to seek professional guidance. Identifying the early signs of pregnancy can be a time of great emotion and many questions. As we've seen, the body is an incredible machine that begins to transform rapidly from the moment of conception, and these symptoms are the first messages of this new journey. Remember, the presence of one or more of these signs doesn't confirm a pregnancy, just as their absence doesn't completely rule it out, especially at the very beginning. A missed period and a positive pregnancy test are the next steps for confirmation. For you who are experiencing this phase of suspicion or planning a pregnancy, we hope this video has brought you clarity. Which of these signs did you already know or have you experienced? Share in the comments. If this guide was helpful, don't forget to like, share, and subscribe to the channel for more health content. Thank you for watching. May your journey be filled with health and discovery.